Hello and welcome to my channel. This is the last lecture in the lower limb series, and we will be discussing the foot, so let's begin. The foot, of course, it's the terminal end of the lower end. There are 5 toes. The big toe is the first one. We start counting from the big toe, going laterally, and the axis in the foot passes in the second toe. Now, when we study the upper limb, the axis will be passing into the third finger from the lateral side or from the medial side, the third or the middle finger. But this in the foot, it passes in the second toe. So abduction, when we talk about abduction, it's away from the axis, and adduction is towards the axis, not towards the body or away from the body. Remember this. The bones of the foot, the tarsal bones, the talus has a head and neck and body. This is the inferior surface of the talus showing here. To show you the sulcus tilli on the inferior surface, this is the sulcus tilli, a deep groove on the inferior surface. It faces the sulcus calcanei on the superior surface of the calcaneus to form the tarsal sinus. Okay, the tarsal sinus. The superior aspect of the talus is called the trochlear surface, and it's broader anterior than posterior. We discussed this in the ankle to make the ligaments more stiff and taut in dorsiflexion rather than in plantar flexion. Okay, it articulates with the distal end of the tibia, and the sides articulate with the malleoli. The lateral malleolus, as you saw in the ankle, is slightly lower than the medial malleolus. The calcaneus, the one you see here, this is the superior surface of the calcaneus. It has a calcaneal tuberosity, which is the weight-bearing area, the one we are standing on. A shelf on the medial side called the sustentaculum tilli. There is a question, multiple choice about this, because the word tilli, so some doctors think that it's part of the talus. No, it's part of the calcaneus, the shelf that sustains the talus. Okay. The sulcus calcanei, we talked about it. It forms with the sulcus tilli, the tarsal sinus, or the sinus tarsi, and has a medial and lateral processes inferiorly, as you can see here. Medial and lateral processes. The navicular, this is the navicular. It's a boat-like, concave from the proximal surface, articulates posteriorly with the head of the talus at the Calcaneo Navicular or the Navicular joint, and at front with the cuneiforms. See, medial, intermediate, and lateral cuneiform bones. The cuboid, the large disc cubical shape rock-like bone, has a groove on the inferior surface for the peroneus longus muscle, and it's bridged by the long plantar nerve. The long plantar ligament on the plantar aspect of the foot. Cuneiforms are 3: medial, intermediate, and lateral. Metatarsals, as you can see here, they have proximal base, shaft, and a distal head, as well as the phalanges, proximal base, shaft, and distal head. Okay, and the 5th metatarsal has a tuberosity, a prominent tuberosity on it. Okay, the phalanges, each toe has 3 phalanges, proximal, middle, and distal, except for the big toe, not the little toe. The big toe has only 2 phalanges, the proximal and distal, and as I told you before, it has a proximal base, shaft, and a distal head. Now for the to dissect the sole of foot, we will start with the skin, remove it. There will be the superficial fascia, which is adipose fatty layer, but in this fatty layer, it's traversed by septa, connecting the skin to the deep fascia, which is the plantar aponeurosis, the one you see here, okay, to form a pad of fat. You know, the fancy sports shoes took their soles actually from this kind of engineering. You know, multiple loculi of high pressure fat loculi because of the septa traversing the fascia. It's like a cushion. The deep fascia, which is the plantar aponeurosis, arises from the calcaneal process and fans, as you can see here. It's going to the metatarsophalangeal joints and the deep transverse metatarsal ligament between the metatarsophalangeal joints. It has some transverse fibers that connects the slips together and sends septa between the muscles of the foot, and thickest, very thick at the center of the plantar aponeurosis. The muscles of the sole of foot are divided for description into three groups: muscles for the hallux or the big toe, muscles for the little toe, and the short digital flexors, lumbricals, and interossei. And we will study them as encountered in dissection in layers, you know, going from superficial to deep or from inferior to superior. Remember this. This is the most inferior structure. When we dissect, we are going superior till we hit the roof, which is the bones of the foot, the undersurface of the bones of the foot. I hope you're oriented now. The first layer is the abductor hallucis muscle. This is the abductor hallucis muscle. It takes origin from the calcaneus and from the flexor retinaculum. It forms the medial border of the foot. It's the medial side of the foot, and inserts with flexor hallucis brevis on the medial side of the proximal phalanx of the big toe. Okay. And it's worthy of mentioning that the medial and lateral plantar vessels and nerves begin underneath the muscle. The action, by its name, it abducts the hallux, abducts the big toe. Sorry about the mistake here, the spelling mistake, bug toe. Okay. The flexor digitorum brevis arises from the plantar aponeurosis and the medial calcaneum, splits into four tendons to the lateral four toes. Okay? Flexor digitorum brevis, as you can see here, lateral four toes. Now, it's like the flexor digitorum superficialis in the upper limb. The tendon splits to pass the tendons of the flexor digitorum longus, then unites and resplits to attach to the sides of the middle phalanges. Okay. The abductor digiti minimi muscle, it's by its name, it abducts the little toe. It's on the lateral margin of the foot, arise from the calcaneal processes and plantar aponeurosis, and inserts with the flexor digiti minimi to the lateral side of the base of the proximal phalanx of the little toe. It abducts the little toe. The fibrous flexor sheaths, these tendons on the fingers, on the toes, sorry, on the phalanges, they are bridged by a fibrous flexor sheath that's composed of alternating transverse and X-shaped, fibers. and inside you'll have structures called the vincula longa and breva, short and long. They are synovial membranes, synovial folds that carry the blood vessels to the tendons inside this tight space, the tunnel under the fibrous flexor sheath. Okay, the second layer of foot, deeper or more superior, we have flexor digitorum accessoris, or the quadratus plantae muscle. Arises from the calcaneus and the lateral process of the lateral process of the calcaneus. It has two heads. Inserts in the tendon of flexor digitorum longus on its lateral side. Now you wonder why it inserts into a tendon. See the direction of the flexor digitorum longus, it's oblique. So when you pull, when the flexor digitorum longus in action, it should flex the toes, but with an obliquity, towards the medial side. Towards the medial side. The quadratus plantae adjusts the pull to make it straight backwards, to flex the toes in a straight manner backwards, not tilted medially because of the direction of the flexor digitorum longus. See? So this is the flexor accessoris. The lumbricals are 4 in number, as you can see here, first, second, third, fourth, arise from the medial surface of the tendons of the flexor digitorum longus. The first one from the medial side, but the other 3 from the adjacent sides of the tendons. They insert in the extensor expansion. See the lumbricals. Now they pass in front of the metatarsophalangeal joint, so they will flex the toe, but they are inserted in the extensor expansion on the dorsum, so they will extend the rest of the toe. So actually to flex it only at the metatarsophalangeal joint and extend the interphalangeal joints, this prevents the buckling of toes under the foot when you take a step, when you put your foot on the ground. When you put your foot on the ground, you're using your flexors as plantar flexion to put it on the ground. Now, if you're using, of course, you're using the long flexor tendons, so this will ultimately flex the toes, but the lumbricals prevents this by extending the interphalangeal joints, at the same time maintaining the flexion at the toes, so you will get the pads of the toes on the ground instead, and prevents the buckling of toes under the foot. This is the action of the lumbricals. Origin from the tendon of flexor digitorum longus. So remember this, the tendon of flexor digitorum longus receives an insertion and gives origin. Now the third layer, the flexor hallucis brevis, arises from the cuboid and cuneiform, inserts by 2 tendons into the side of the base of the proximal phalanx. This is the flexor hallucis brevis. See? By 2 tendons, it splits. And in each tendon there is a sesamoid bone, because the weight is maximum at this area, at the base of the proximal phalanx of the metatarsophalangeal joint of the big toe. See the 2 sesamoid bones in the flexor hallucis brevis, and remember, attaches to the sides of the proximal phalanx. The adductor hallucis has an oblique head and a transverse head. The oblique head from bases of 2nd to 4th metatarsals, as you can see here. The transverse head from the metatarsophalangeal joints of the 3rd to the 5th toes, and deep transverse metatarsal ligament. Okay, inserts into the lateral sesamoid bone and base of the proximal phalanx of the hallux. By its name, it adducts the hallux. Flexor digiti minimi, this one, from the base of the 5th metatarsal to the lateral side Please pay attention here. To the lateral side of the base of the proximal phalanx of the fifth toe, together with the abductor digiti minimi. The fourth layer, we have the interossei, the dorsal and plantar interossei. These are the dorsal interossei. Now, they are 4 in number. I don't want you to learn the attachments by heart. It's hard to learn all these attachments together with the plantar interossei without getting confused. But use some rules and understand the attachments. How? Well, there is a rule that dorsal interosseous abducts the toe. Abducts, so away from the axis. And the second rule is if the muscle is doing an action, we don't need another muscle with the same action to repeat it. So if we know that these interossei abduct the toes, so we don't need to attach them to toes that already have abductors. Yes, exactly, like the big toe and the small toe, because they have abductor digiti minimi and abductor hallucis, so there are no interossei for these toes. Now for the second toe, it has the axis in it. So abduction either this way or this way. So in both sides, we need to pull it to abduct it from the axis that remains, of course, level with the second toe. So it has 2 dorsal interossei. See? Attaches to the adjacent sides of the metatarsals and to the 2 sides, medial and lateral, of the proximal phalanx of the second toe. Now the third toe, we need to abduct it, dorsal interosseous, so abducts. So we need to attach it in the lateral side of the proximal phalanx of the third toe. And the same applies for the fourth toe. None for the little toe and the big toe. See, now you understand the attachments. You don't have to learn them by heart. Just know the rule that dorsal interossei abduct, okay, and plantar interossei adduct towards the axis. Now the first dorsal interosseous transmits the dorsalis pedis artery, as we discussed earlier, and all the interossei transmit the perforators. Remember, there are proximal and distal perforators between the dorsal interosseous artery, the arteries, and the plantar interosseous arteries. The action abduct the toes. Now these are the plantar interossei. Let's think about them. They adduct the toes. The big toe does not need an adductor because it has its own adductor, the adductor hallucis. So no plantar interosseous for the big toe. So the big toe has no plantar, neither dorsal interossei. Okay, the second toe, it cannot be adducted on itself. So no plantar interossei for the second toe. Got it? For the third toe, as you notice here, it's not to the adjacent sides. The interossei are not attached to the adjacent sides. Okay, only to one side of the metatarsal. So you can see the dorsal interossei from the ventral aspect, from the plantar aspect. But you cannot see the plantar interossei from the dorsal aspect. Got it? Okay, the first plantar interosseous attaches to the medial surface of the proximal phalanx of the third toe. The same for the second one, medial aspect for the fourth toe. And here, because there are no adductor digiti minimi, so we need a plantar interosseous for the digiti minimi, for the little toe. So also it has a plantar interosseous that's attached to the medial side of the phalanx of the little toe. Okay, got it? It's easy. Once you apply the rules, it's very easy. Do not learn them by heart. Do not learn them by heart. Okay, now the intertarsal joints. We have a subtalar joint. Subtalar means all this joint. Subtalar joint. The subtalar joint, the anterior is the talocalcaneo navicular. Talocalcaneo navicular. Okay, this is the medial side of the foot. This is the navicular. This is the talocalcaneo navicular joint. This is the head of talus. Okay? Posterior is the talocalcaneal. So this is the talocalcaneal. This is the talocalcaneo navicular, and together they are the subtalar joint. Okay, the talocalcaneal joint, which is this one, it's synovial of the saddle type. It has a convex articular surface belongs to the calcaneus, and a concave articular surface that belongs to the talus. The capsule attached around the articular margins. The ligaments, medial and lateral talocalcaneal ligaments. Interosseous ligament that fills the sinus, or the sinus tarsi, or the tarsal sinus. This is the tarsal sinus. It's filled up by the interosseous ligament between the calcaneus and talus, superior surface of calcaneus and inferior surface of talus. The anterior part, okay, the anterior part, anterior surface of this ligament, belongs to the surface of the talocalcaneo navicular joint. And the posterior surface of this ligament is for the talocalcaneal joint. It's taught in eversion. The cervical ligament, it's from the superior part of the calcaneus to the neck of the talus. Superior part of the calcaneus to the neck of the talus. It's deep to flexor digitorum brevis muscle. Now the talocalcaneo navicular joint, this is the navicular bone. The talus is removed. This is the superior surface of the calcaneus, and this is the sustentaculum tali. Okay, the head of the talus articulates with the concavity of the navicular and the superior surface of the sustentaculum tali, which has the spring ligament attached to it and covered by fibrocartilage. So it's a synovial joint of the ball and socket variety. Okay, don't be surprised. We have a ball and socket bone, the ball and socket joint in the foot. It's the talocalcaneo navicular joint. The ligaments of this joint, we have the talonavicular ligament. We have the calcaneo navicular ligament, part of the bifurcate ligament. I'll show it to you. And the plantar calcaneo navicular ligament, which is the spring ligament. Spring ligament, the calcaneo navicular ligament, the spring ligament. Okay. The transverse tarsal joint, the one noted here, a transverse tarsal, it's composed of the talonavicular and calcaneo cuboid. Calcaneo cuboid and talonavicular. The talonavicular joint part of the talocalcaneo navicular joint. Calcaneo cuboid is a synovial of the saddle type and the capsule attached around the articular margin. The ligament, the famous ligament, is the bifurcate ligament for the calcaneo cuboid joint. Actually, the bifurcate ligament, the lateral part for the calcaneo cuboid, and the medial part for the talonavicular or the calcaneo navicular joint. Okay. Ligaments, the bifurcate ligament. This is the bifurcate ligament. Okay. Attaches to the upper surface of calcaneus. Has calcaneo navicular part, which is the lateral wall of talocalcaneo navicular, and a calcaneo cuboid part. Okay? The long plantar ligament, the one you see here, that bridges the groove for the peroneus longus muscle in the cuboid bone. It's a tough ligament, and on the lateral side from the calcaneus going to second to fourth metatarsals. as you can see it here. Underneath is the short plantar ligament, attaches to the calcaneus and cuboid. It's a very strong ligament. Now the rest of the joints, like cuboido-navicular, cuneo-cuboid, cuneo-navicular, intercuneiform, and intermetatarsal joints, are all synovial of the plane type, and all have dorsal and ventral or plantar ligaments. They have dorsal ligaments and plantar ligaments as thickenings in their capsules. Now, and the capsule cavity, by the way, the synovial cavity is joined in some joints. Movements at the tarsal joints. Inversion, this is mainly produced by the tibialis anterior and tibialis posterior. Eversion, mainly by the palmaris longus and the palmaris brevis muscles. The metatarsophalangeal joints are the synovial of ellipsoid type because they have flexion, extension, and they have side-to-side movement. Okay, abduction and adduction, side-to-side movement. Biaxial joint has plantar and dorsal ligaments, also has the deep transverse metatarsal ligament. See, deep transverse metatarsal ligament. The superficial transverse metatarsal ligament is in the skin, in the web between the toes. Okay, it enlarges in swimming birds, birds that swim, like ducks. The interphalangeal joints are simple hinge joint of synovial variety. Proximal interphalangeal joint acted upon by the flexor digitorum longus and brevis, while the distal interphalangeal joint only by the digitorum longus, because it's the only muscle that reaches the distal phalanx. Okay, the flexor digitorum longus muscle. Now we'll talk about another issue, which is the arches of foot. We have medial arch, medial longitudinal arch, lateral longitudinal arch, and transverse arch. These arches, because of the articulation, the way the tarsal bones and metatarsal bones articulate together, with, of course, the ligaments that fix them. Okay? So they form arches. The medial arch, the medial longitudinal arch, is raised off the ground, and the lateral longitudinal arch is on the ground. Okay? Now, when we study the components of each arch, the medial arch starts with the calcaneus, then the navicular. Okay? Some books consider the talus as well. Then the navicular, cuneiforms, and medial 3 metatarsals. It's elevated from the ground. Cuneiforms and medial 3 metatarsals. The lateral arch is by calcaneus, cuboid, and lateral 2 metatarsals. Now I want to remind you of something. Remember that the flexor hallucis longus tendon gives 2 slips to the second and third toe tendons of the flexor digitorum longus. Remember that? Why? To continue the support of the medial longitudinal arch, because the medial longitudinal arch involves the medial 3 toes, the medial 3 metatarsals. Okay? So to continue the support for the arch, okay, that's why the flexor hallucis longus gave 2 slips to the tendons of flexor digitorum longus going to the second toe and the third toe. I hope you got that. Okay. Now, structures or muscles supporting the arch. Of course, the ligaments support the arches, make it maintain its shape. Support the arch means let it maintain its shape. On the lateral side, what supports the lateral longitudinal arch? Anything that pulls on the ends of the arch like a beam. Okay, like a beam. For example, the long plantar ligament and the long flexor tendons, right? This is like a beam. How you support a bridge you attach its ends by a beam and pull on, or suspend its peak, its convexity. What suspends the convexity here? It's the peronei, the peroneus brevis and peroneus longus, by pulling on the middle of the arch. See how the arch is supported, or what influences the arch? The peronei longus and brevis pulls, because it pulls on the convexity of the arch. And the beams down there are the long flexor tendons and the long plantar ligament. On the medial side, it's the same idea. What supports the arch? What pulls on the convexity of the arch? The tibialis anterior and tibialis posterior muscles. Right, exactly. What supports the arch? The long flexor tendons. Right? And don't forget that all the ligaments that attach the bones together also, support or maintain the arches. The transverse arch is by the basis of the metatarsals, the cuboid, and the cuneiforms. See that? It's concave upwards. Concave upwards. And elevated from the ground medially, along with the medial longitudinal arch. Now, what's the main support for this transverse arch? Let's apply the beam theory. What holds this end to this end? Yes, exactly. The tendon of peroneus longus muscle. Tendon of peroneus longus, because it traverses the foot from lateral to medial. So it pulls on the both ends of the transverse arch, the tendon of peroneus longus. Now we have two cases: talipes equinovarus, which is the drop foot, in which there is injury to the common peroneal nerve. You will find this in motorcyclists. Very common, because they fall on the lateral side of the leg with a motorcycle, so it crushes the common peroneal nerve against the neck of fibula, if not fractured the neck of fibula. What happens if you injure the common peroneal nerve? There will be no superficial and deep peroneals, so there will be no extensors, exactly. So the foot will be plantar flexed, dropped. And what do you think, everted or inverted? Okay, it will be inverted by the action of the tibialis posterior muscle. Okay, tibialis posterior muscle, which is supplied by the tibial nerve. Okay, the Calcaneo Valgus case, in which the foot is dorsiflexed and lateral or everted. So there is no inversion, there is no plantar flexion. What causes this injury to the tibial nerve? Because supplies the flexor compartment of the leg. Okay, I hope you got the maximum benefit of this lecture. Next lecture we'll start learning the upper limb. Again, I hope you got the maximum benefit of this lecture, and thank you very much for watching.